my name is Lexis Perry. I'm a senior majoring in exercise science with a concentration in pre-athletic training, and today we'll be doing the knee and patellofemoral evaluation video. Okay, so first I have to palpate the location of the dorsal pedis artery. Okay, which would be right here. And then I have to palpate the location of the posterior tibial artery. So I'm gonna put the pistol to here. Got that with him. And then I have to practice the capillary refill test. So squeeze your foot. And let it refill. And do it again. Let it refill. That indicates that there's proper circulation to the feet. Okay, and next we will be doing the active range of motion for knee flexion. So if you could please flex your knee for me. And bring it back down. Flex one more time, please. Okay. And now you sit up. And now you're doing the active range of motion for extension. So come a little bit further. All right. And okay, just extend your knee. One more time. Okay. And now we'll be doing the main muscle test. So okay, so now basically you'll just be going against my resistance. So extend. Alright. One more time. Okay. And now I'll be doing the manual muscle test for the isolation of the sartorius. So you're basically going to bring your foot and this way, lift it up like that, but you're going against my resistance, okay? Alright. And go. And for extra dry skin, age perfect all over Honeyball. And if you could please lay on your stomach again, so we can do the manual test for flexion. Okay, and can you please try and flex your knee?
It's all about choice.
One more time. So we also have to test for passive extension and flexion. So I'm going to do flexion first, and I'm just going to move it for you. Don't this way. So this is flexion. And then just sit facing the camera, please. Okay. And this the extension. Alright, next we will do the apprehension test for patella instability. So, find your patella, push that way, also push this way. Okay. Alright, next we will be doing the sweep test. So, okay, and the positive test for a sweep test would be reformation of edema on the medial side of the knee when pressure is applied to the lateral aspect. And did you feel any pain on this side? No. Okay, so he is good. All right, so next we will be doing the test, the valgus stress test for the medial collateral ligament laxity. So take your knee. And it's not going in at all, so you're good. Okay, and then I will also be doing the varus test, which tests for the lateral collateral ligament laxity. So, inside, and just push it out. And his knee is not moving at all, so there is no laxity in his knee joints. Alright, so next we will be doing the Lockman's test for the anterior cruciate ligament laxity. So take your knee right here. I'm just going to pull forward, and it's not moving, so there's no laxity in his ACL. So next we will be doing the anterior drawer test, which tests the ACL laxity. So here, I'm just gonna pull forward. There's no laxity at all. Alright, and next we'll be doing the posterior drawer test, which tests the PCL laxity. There's no laxity, so his ACL and PCL are stable. Okay, next we will be doing the Slocum drawer test for the rotational knee instability. So have your foot turned in here, about 45 degrees. You take the front of your knee, you're gonna pull forward. Alright, just gonna joint laxity, so then I'm gonna ask you to straighten up your foot, sit on it again, and pull forward. Okay, and that test, a positive would be an increased amount of anterior tibial translation compared with the opposite limb, or the lack of a firm endpoint. He did have a firm endpoint, so it's not a positive. Okay, so next we will be doing the posterolateral, posteromedial drawer test for posterolateral knee instability. So I'm gonna actually turn your foot up this way as much as you can. I'm gonna push down. Okay, and then I also have to turn it inside. Foot and push inward. Okay, a positive test would be increased external rotation of the lateral or medial tibial condyle relative to the uninvolved side, and there was no lateral translation, so that's passed. Okay, next we will be doing the quadriceps active test. So, take your knee down, your ankle, from the top of your finger, and if you could, please, just slide your foot forward. Using only like your quad, so just push your foot forward. Okay. Take it back.
No, good. I'm using was the same $100 in the commercial until that go.
Okay. And a positive test would be anterior translation of the tibia on the femur. The next test that we have to do is the Godfrey's test for posterior crucial ligament laxity. So if you could lay on your back. Alright, and lift your legs up. Lift both of them up. Bend your knees at 90 degrees. Alright, so I'm gonna hold your feet. Alright, and just hold them up in this 90-degree position.
You do know you just handed me your biggest partnership. Declaration of Independence is not a partnership.
And you can bring them down.
Let me see.
His legs were even on both sides. A positive test would be a unilateral posterior displacement of the tibial tuberosity, which there isn't. So that was a pass. Okay, and next is the proximal tibiofibular syndinosis joint play. So, tibia, fibula, take that joint and just move it. Sorry if it feels weird. With my faith. Alright, and his joints are still stable. Okay, and next we will be doing the McMurray's test for meniscal lesions. So, I'm going
Sorry for your suffering, man. For the record, then.
Okay.
You know,
And a positive for the McMurray's tissue test. is a popping, clicking, or locking of the knee, pain emanating from the menisci, or a sensation similar to that experienced during ambulation. And there was no popping or cracking of his meniscus, so that is a pass. Next, we have the Apley's compression and distraction test for meniscal lesions. So if you could please lie prone, so just lie on your stomach. The other way, so you're 5, 6 in the camera. Okay. And with the Apley's compression test, I'm just going to take your knee right here, go to the back of your thigh. I'm going to turn your foot inward. Go from this way so you can see it. And I'm going to push down. Turn your foot outward and see it. Okay. And a positive would be pain experienced during compression that is reduced or eliminated during distraction. So when I was pressing down on you, did you feel any pain? Okay, he said there was no pain, so he does not have a meniscal tear.
Offers across the Denali lineup during the GMC Denali season to upgrade. Like over $12,300 total value on the specially equipped Sierra when you finance through GM Financial.
Next, we will be doing the Thessaly test for meniscal tears. So, you can...
This week on GMA will be big and wet when Aquaman comes above water for GMA. Plus Margot Robbie, Julia Roberts, and what happens when Jennifer Aniston and Dolly Parton interview each other. Oh yes, this week will be good on Good Morning America.
This episode of Sports Center is presented by Microsoft, empowering us all, and in part by Pizza Hut. No one out pizzas the Hut.
Just another step on the mountain that we're trying to climb.
We belong in the playoffs. Now you got to go play some of the finest football teams in the country. Got to fight and scratch from far away, get back this opportunity.
How's your bracket? Well, unless you're Ohio State and Georgia, it's fine. Clemson, Notre Dame in the Cotton Bowl, that's 4 o'clock. Late game on December 29th in the semis. The College Football Playoff features Alabama against Oklahoma. Heisman contending QBs in the Orange Bowl there.
And lastly, we will be doing the crossover test for rotational knee instability. And as you can see, he's already in the stance. Has his right foot over the left one. So the left one stays still. And you just turn your torso to the right. Okay. Now I'm going to ask that you switch your feet. So, right, and turn. Okay. Did you feel any pain?
No.
Okay. So the positive test, the patient will report pain, instability, and apprehension. He displayed neither, so he is fine.